Hi, Senator Rubio. My name is Tanya Conway from Green Acres, Florida, and I'm sending you this message urging you to please vote no on Trumpcare. This will affect my family personally. My son has got a condition called hemophilia. It's a blood clotting disorder. It is required that he takes medication to stop any bleeding because his body does not produce the factor like you and I have to clot our blood. Without his medication, he would die. He just went to the emergency room back in May for a cut foot on a piece of glass. For one dose of medication to stop the bleeding, it cost over $50,000 for one dose. Sometimes when he has bleeds internally in his joints, he can need factor for a week, 2 weeks, just depends on the bleed. If he had 2 weeks worth of medication given to him, it would be $700,000. There's no way me and my family can afford this. Without insurance, he would die. My grandson is on Medicaid. If he loses his Medicaid, he also will die. He's 10 months old. If you guys approve this Trumpcare and we have lifetime caps, my son and my grandson with medication that high and that expensive, and that is just one dose of medication. That is not the other supplies that is also added in there, or the doctor visits or the emergency room visits. It's just outrageous. We cannot afford this. Please, please vote no on Trumpcare. If they did a lifetime cap, my son would die. If this was your child, Senator Rubio, wouldn't you be fighting for your child's life? I'm begging you. Please don't let my son or my grandson die. Please don't put greed above the lives of millions of people in this country. We all deserve health insurance. It's a human right. Thank you for taking the time to listen. Please vote no.
Whenever you're ready.
My name is Dawn, and I'm from Plantation, Florida. And I just wanted to talk about a little bit of the experience that I had with medical care. My longtime boyfriend of 20 years was diagnosed in 2013 with a very rare form of cancer called systemic mastocytosis. It took them a long time to even find out what he had. And he was a month to 3 months away from death. And we had to go to MD Anderson Cancer Center in Houston, Texas for medical treatment because he needed a stem cell transplant, and there was a doctor there that had dealt with his kind of cancer before, and so that's where we were going to go. This was a very expensive procedure, millions of dollars, and he just had regular insurance. Well, luckily for us, in 2014, the Affordable Care Act kicked in. If it wasn't for that, he would be dead. Because he was able to get good insurance. It wasn't cheap, but he was able to get good insurance to save his life. And even now, we have to go back to MD Anderson a couple times a year, and he'll probably have to go back there once for the rest of his life, because you just never know with these things. And there's one more thing I want to say. Besides the savings of health care for our fellow citizens, I have to say something that's disturbing me. I've heard and seen some groups that want to cause division and hate between the American people. I remember a time when Democrats and Republicans worked together for the American people, and compromise was not a dirty word. Senator Rubio, you're a young man. You don't remember those days, but I do. And I only wish that we can get back to those times where this one's not the enemy. We're not each other's enemy. We're all Americans, and we're all working for the same thing. And one of the things that stands in my mind is Those who don't know history are destined to repeat it. United we stand, divided we fall.
Hi, my name's Elsa, and I've lived in Broward County for the last 20 years. My story for you, Senator Rubio, is about our son, Jimmy. After our first batch of children were raised, we adopted a child with multiple disabilities. Jimmy had been severely premature. He weighed 1.5 pounds when he was born. He had autism, he had cerebral palsy, he had asthma. We were able to find a program, a special needs adoption program, that enabled him to keep Medicaid and still become our own son. The Medicaid was essential to keep him alive. And in the hospital where he had been living before we were able to adopt him, there were so many children with multiple disabilities, critical health issues, that had no opportunity for health insurance, and no health insurance company would have accepted them. Jimmy lived to be 22 years old. He learned to walk, he learned to talk, he could read with some difficulty. He knew 30 countries and their capitals. If he meets somebody from Egypt, he would remember the capital of Egypt is Cairo. He knew every state in the United States and the capital of each state. He was a joy and a delight. All the children that have severe disabilities need Medicaid. If you cut the funding for Medicaid, the providers limit the number of Medicaid patients they'll take. They won't accept every child that has a Medicaid issue. This is too important. This is more important than tax cuts for people who have enough money already. If people believe that abortion is a problem, and you cut funding that causes children to die, isn't that just as bad? Senator Rubio, I think you should look and see if this policy is consistent with beliefs that you've stated before. Thank you.
Good evening, Senator Rubio. My name is Richard Lebonsky. I live in Lauderhill, Florida. I've lived here for 20 years in Broward County. I've been following the healthcare discussions in the Congress for the past several months, and I'm appalled that the best thing that the Republicans have been able to come up with is plans that deny healthcare coverage to upwards of 23 million people. I've communicated with you before and expressed my opinion that Republicans could very easily help repair what's wrong with Obamacare, the Affordable Care Act. In my view, this is the most significant program that can be corrected to provide the necessary care for people in the United States. If the Republicans persist on providing marginal health care or very limited benefits and drive people away from health care insurance and health care coverage by virtue of high premiums and high deductibles and copays, we will have no choice but to demand a single-payer health care system. And we will rise up and demand this. So I urge you, at least consider working with your colleagues, the Democrats and Republicans, to repair the Affordable Care Act. This, I think, is the most reasonable way to approach improving health care in the United States. And it takes care of the needs of your citizens and your constituents. Thank you very much.
Hi, my name is Terry Lopez Preuss, and I am the Vice President of the Broward Teachers Union. We are the 5th largest union in the United States of America. I'm also a citizen and an immigrant, and I've been very happy to come here to the land of opportunity and be able to do so many wonderful things with the opportunities that this land has afforded me. When I got married, I married a German, and he was so excited at the possibility of coming here to this country to live with me. But before we did that, we spent a little bit of time in Germany. And as it turns out, I got very sick in Germany. And he ran me right into the nearest hospital, and I was very busy trying to find my insurance card from the United States because I was sure that somewhere on that card it showed that I would get coverage in Germany. Everyone was laughing at me. They didn't even want to know my name. They just got me in there. They knew I needed care, and they took care of me. That was the beginning of my husband's awakening to how different things were going to be for us in the United States of America. And I can say that of all of the wonderful dreams that we've been able to realize as a married couple, my husband is still a German national, the one thing that he doesn't understand is why we cannot have good health care in this country. In Germany, when you're ill, you get treated. You don't have to prove that you have an insurance card. When we were raising our family as a teacher on a teacher's salary, I had to pay almost $1,300 to insure my husband and my 2 children. That is just not okay. And as a German national living here in this country, he has seen how difficult it is sometimes to get good care and how many hoops you have to jump through. So I'm just asking that we limit the hoops, that we stop this, that we find a way to take care of our people. If we are the greatest country, and we say we are, then let's do that for our health care. Let's have our citizens feel safe and feel that they can get the treatment that they need here in America and that they don't have to worry, because worrying is what makes a lot of people sick. So if I could just ask one thing, it's that Americans would know that when we feel comfortable living here in this great land and having all of these opportunities, that one of the opportunities that we have is to be healthy and to know that our health is cared for by those people and politicians who are making the laws for us and governing us, and that we are putting people first. People over profits. That's what I would like to see. Thank you.
Hi, my name is Trudy Germanovich. I live in Fort Lauderdale, and I'm a member of the BATS, Badass Teachers Association. Tens of thousands of teachers around the country are represented by our organization. And when I ask them, what do you want me to talk about when I talk to Mr. Rubio? They said, please tell every senator out there that we need Medicaid funding for the public schools. When I was teaching, I had students that had autism, they had spina bifida, I had a student that had a liver transplant. None of those students would have been in my classes. They would have been somewhere else if we didn't have Medicaid funding in the public schools. Now, you might say, well, something else will pick up that funding if you take it away. No, it doesn't. What happens is you will give them, take away the Medicaid funding, and then we will have to take money away from the regular students and give it to those students that have those needs, because it's a federally mandated program that we take care of those students in the least restrictive environment, which means in a classroom. And it also means that other students are in the classroom with those students. So it's very, very important that we keep Medicaid funding. The other thing that happens is when you take that money away, again, it decreases the amount of funding in the public schools. And since in the state of Florida, we are giving more and more funding to charter schools and vouchers to private schools, which don't take these students, then more and more is placed on the public schools. Just remember, we're not going away. We're watching, and we will hold you accountable. Thank you.
Senator Rubio, here's my story. I'm a K-1 teacher in Fort Lauderdale, and my student and his family kept on requesting services through Medicaid for him to get therapy for a situation that was going on at home, and the situation got worse to the point where I received a concussion from the student and basically missed the last 3 weeks of school and could not be with any of my students because I had to get cleared for my concussion, and because of that, the student is now receiving services through Medicaid and has a therapist every single week at his house and is now being transferred to his school next year, and he is doing super amazing and well. And personally, I have a 36-year-old cousin who receives Medicaid, and because of that, he has been able to go through the public school system in Massachusetts And when I moved here, I didn't understand why Florida does not do the same thing. When I request something in school, it doesn't get done. However, in Boston, it gets done. And I was able to see the lack, and I don't understand as a nation why we're not being united and together. Every single child deserves every single thing that they need to get to be successful. And that's what you need to take care of, Senator.
Hello, Senator Rubio. My name is Shane, and I'm from Davie, Florida. I am concerned about Trumpcare. I'm a 52-year-old male who's had health care all my life, relatively good health care. I'm concerned about those around me who don't have health care. My employer put all of our part-time workers on Obamacare and removed the health care element from our benefits. I'm afraid that 10,000 employees will be without health care, and these are people my coworkers. I also am concerned about people with debilitating conditions around me, friends, relatives, and others who will be thrown out of the healthcare system. It's not fair. It's not fair to the 23 million Americans who are part of this country, and it's not fair to Florida. Tens of thousands of Floridians will be without health care if this atrocious bill goes through. We're asking you to not allow Trumpcare to go into existence. We want you to actually make the affordable health care better. We've never said that it couldn't be better. And that's what you're in office to do, and we expect you to represent our wishes. We want health care for every American, and we want affordable health care, and it's important to us all. So take a few moments and look around you in Florida. I know you're not here much, and please look around and understand that Florida is behind the affordable health care, and we demand action.
Hi, Senator Rubio. My name is Rebecca from Sunrise, Florida. I'm a thyroid cancer survivor, and there are two parts to my message. The first is that Planned Parenthood found my thyroid cancer when it was really small. And at the time, I was self-employed as I am now, and I didn't have health insurance. And my affordable health care was to go to Planned Parenthood. So, one, I'd like to encourage you to please support Planned Parenthood. Planned Parenthood is rarely about abortions. It's about health coverage and health care for women of all ages. It's about breast cancer screenings, in my case, thyroid cancer screenings, all kinds of care that women and men need and procure at Planned Parenthood, and we need to support Planned Parenthood. And two, I'm still self-employed, and I am currently paying for my own health insurance. Obamacare afforded me the ability to have health insurance coverage through the marketplace. And I'd like to encourage you to please consider doing all that we can to improve Obamacare and not replace it with the disaster that is Trumpcare, that will throw thousands or millions of people, actually, throw millions of people off of health care coverage. People like me who are cancer survivors, who need health coverage. I will be uninsurable under Trumpcare because I have a pre-existing condition. So I urge you to listen to all of us, your constituents here in South Florida, and please be on our side. And, you know, we need you. We need you to support us. We need you to support affordable health care for all of us that actually does help and cover all of us. Thank you.
Senator Rubio, I'm asking you to keep your hands off of our health care here in Florida. We have 1.5 million of our fellow citizens who rely on the Affordable Care Act offered through the exchange. These are some of our most vulnerable and needy citizens who are the most hardworking and need access to affordable quality health care. I'm asking you to vote no on this new proposed health care bill in the Senate to continue access to 1.5 million of our fellow citizens. Their lives depend on it. All of us need to stand up and support health care as a basic human right. And that's what I'm going to do if elected to the Florida House of Representatives in 2018. Thank you so much.